So another case of bite balancing by composite, purely by composite, maximum in 90%, where patient had multiple complaints which are listed in the link below of extraoral symptoms and intraoral signs and symptoms. So to save them from further damage, we did a bite balancing. Bite balancing means we are creating a canine guidance. So when the canines touch, posteriors don't touch, and distribute the pressure and reduce the hit and slide. That is the, and create an anterior guidance. That is the ultimate aim for bite balancing. And so that teeth don't wear or fracture, they don't end up with root canals. So to prevent them, whenever you want to do bite balancing, as early as 20 years, 30, 40, 50, whenever you do the bite balancing, it will reduce the future damage, it will reduce the wear and tear, and you can save the teeth for a longer time. So in this case, we did a bite balancing. The current state was that multiple teeth were crowns over a period of time. This is crowns. This is bone teeth. So teeth wear off, they go and end up with root canal. So some teeth have more pressure, some teeth have less. We, in bite balancing, we rebuild the teeth which are bone without grinding them and balance them so that the forces are distributed and further damage is reduced. So it's a prevention system. Now in case of this, if you see, we have restored with composite. Clearly, without doing anything, we just build it up. This is the way we build up with composite. Without grinding any tooth, we just build up. So wherever, and basically on occlusal parameters we have to consider for building up, but since we cannot just restore one tooth or do complete bite balancing by one tooth, we have to do in microns and millimeters multiple teeth to balance them. So in this case, if you see, we have balanced it and we have rebuilt. These are also composite. These are all individual composite without grinding a single tooth. So in future, whatever the damage will be less. In case damage, then composite will be damaged. The original tooth will be saved. So nothing will happen to the original tooth. They will not end up with root canals. Now this is the way we just build them. So we just build them with composite. You can see we just build slightly. Some teeth are here, some teeth are built, some canine tips are built, and we just build them and balance them. So multiple teeth are balanced. First we check the imbalance level and then we just rebuild them. So if you see them, I'll show you here. This is the original state, and if you see when I balance them, this is balancing. So this is known as composite balancing without grinding a single tooth, and we have balanced the occlusion. Wherever necessary, we build the cusp tips. So we create the occlusal locks, we reduce the slide, create canine guidance, create anterior guidance, and reduce hidden slide and reduce the further damage of teeth. You can clearly see this portion. I can show you. This is one tooth, and we have built it up. So this is one state, we build it the composite. This is one tooth, so you can see the cusp. This is the original state, and we build this is the original state, and we have just built it up. Okay. So now whenever we balance the occlusion, we have to do imbalance check first and then balance it by rebuilding them with composite, the maximum time with composite, because natural teeth we don't grind them, we don't do root canals. This is an addition of composite on the tooth, so we just balance them by adding them. Now if you see this from side view, I will show you here. This is add-on, this is add-on. This is the original state. It is a bone state. You can see the enamel here gone. You can see the dentin here, dentin here, dentin here, and I'll show you. This is the one which is rebuilt, composite added on. Composite added on, and then we distribute the force. You can see the dots here. We check the forces are equally distributed or not. Once they are distributed, then the wear and tear is less. See, you can see from here, this is the original state, and we have built them with composite, and it is, and the best part is that we haven't shaved off any portion of tooth. Now this is the from inside, if you see, this is the original state and this is the rebuild of composite.